Could the reason you feel tired, foggy, or off balance have nothing to do with age and everything to do with how many pills you are taking? If medications are supposed to help us heal, I wonder why do so many people end up on 5, 10, or even 15 drugs and feel worse than before? To help us understand, this complex issue and how to remedy it, today we're joined by Reshma Patel, a doctor of pharmacy, a consultant pharmacist who helps patients and providers reduce medication overload safely and effectively. She's got more than 20 years of experience in hospital and clinical setting. She's seen firsthand how this polypharmacy robs people of vitality and how the right guidance can give it back. So just as a reminder right now, you're watching WellWaveNOW. This is where timeless wisdom meets modern insight to help you live better and hopefully do so for longer.
Yeah, so welcome to the program, Dr. Patel. It's great to see you again.
Yes, thank you for having me. Appreciate being here.
Yeah, of course, I love the doctors from my industry with community pharmacy and all of the insights and help that our good PharmDs have. And so let's, hop into the topic today. Most people assume that their doctors are watching out for them, right? And they're checking their medications to make sure there's not any overlap or drug interactions. But the reality is no one is really in charge of that except for the patient. And so, one doctor adds a medication, a specialist adds another medication. You've got a third doctor adding something else. And before long, you've got a medicine cabinet full of pills. And so the first, I always think of it like this, the first one or two medications are probably treating a symptom, right? But medication 3, medication 4, medication 5, they're now probably counteracting the side effects of medication 1 and 2. So pretty soon you're stacking all these medications on top of each other. And that's what we want to dive into that topic today. So if you're listening right now to the WellWaveNOW podcast, picture your own medicine cabinet at home and how many bottles of medicine do you have in there? And also let's include the supplements and the OTCs or the over-the-counter. If you have more than 5, you're probably already living with polypharmacy. And that is going to be the topic that we're going to discuss today. So Dr. Reshma, give us the definition. What is polypharmacy?
So polypharmacy is when you are on 5 or more medications, and we are seeing that 1 in 5 adults are on 5 or more medications, and half of our older adults are on 5 or more medications. And so we're seeing an increase in the number of medications that patients are on. And as we tend to be on 5 or more, the addition of more than that is, it grows. And polypharmacy is when we're on 10 or more medications, which is actually very, very common in our geriatric population right now.
Yeah, a good friend of both of ours, who is focusing on that geriatric, level. And I asked him if he could, recall someone and the most medications that they were on. And there were over 28 medications. He was able to eliminate all but like 4 or 5 of them by going through the process. So it's amazing how many. If there's a next level beyond what you described, that would probably be it, right? 28 meds.
Yes, definitely. And that's actually a pretty common number that we're seeing out there in the industry. And just to what you alluded is we're now treating the side effect of the first 5.
So why is this such an either invisible issue or ignored issue, even for people who see their primary care doctor regularly?
Yeah, there's many reasons I feel that this has become an invisible issue, like you mentioned. Patients are seeing multiple providers. They feel overwhelmed with their medications. They may not be taking them appropriately. Counseling, having your prescriber look at your meds. Things just get slipped between the cracks. And we're now seeing that patients are presenting with symptoms due to those medications that they're on and thinking that I'm presenting with another disease or I need another medication for this symptom. And so they go to their provider and ask, is there something I can take for this? And not really thinking that maybe the first few medications that I'm on is the reason that I may be presenting with this symptom. And sometimes physicians as well, they're so overburdened, don't have enough time to look at the patient's meds, to do a full evaluation to see if maybe a medication is presenting that symptom for the patient versus an actual new disease.
That's really interesting, though. 'Cause, we think we're treating a symptom that was, caused by something else, but that symptom
Mhm.
is actually being caused by or a side effect of the medication that the patient is on.
Yes.
Dr. Bob, you've had a little bit of experience researching this in your career.
Well, there's several factors here, as Dr. Reshma pointed out. We don't know what's the primary, the primary drugs. What are they doing? They're maybe helping certain symptoms and then producing side effects. And the side effects can be worse than the conditions that the patient experienced in the first place. And the other thing is, people want to realize, even the younger people who are listening, you may not be on too many medications now, but the physician, the primary tool of physicians are pharmaceuticals. And so they're going to be encouraging you when you show up with a symptom to take these pharmaceuticals. And then you end up having, if you end up having more than one, you're out of evidence-based medicine, because these trials, clinical trials, do not test A plus B plus C. So all of this is just, polypharmacy is kind of crazy, because it's never been tested that way. And then, and also these potent chemicals. I mean, really, these are really, I can't even imagine having 5, 8, 10, 20. And I think it's fabulous what you do, Dr. Reshma. It's such an important thing to help people wean off some of this stuff. And as Breck said, maybe even do some drug holidays for those pharmaceuticals that are not needed to sustain life. In other words, the patient would not have a life-threatening situation if they were withdrawn from certain pharmaceuticals.
When we look at the problem, Dr. Reshma, obviously you've spent a lot of time, you and Dr. DeLon have spent a lot of time with the elderly, right? And so age is a contributor to the problem.
Mhm.
But we're seeing this polypharmacy with all ages now. So is it bad habits? Is it chronic disease? What is the start of the issue?
To say it's all of it. Not only is it just aging itself, but our lifestyle, the way we work now, dual income, so many different factors I feel like contribute to this increase in polypharmacy and over medications, a fast fix. Um, and then, a lot of polypharmacy mimics aging. So we may think, oh, I'm just getting older, or I was at my computer for such a long time, so I have this pain. But in reality, it could be the side effect of your medication. So bringing awareness to that, and always asking if you are on medications, which now a lot of adults, even in their 40s and 50s, is something I think that we need to shift our mindset, is to ask, could it be my medications that's causing the pain
Yeah,
or
so
the
that's
side effect?
one thing I was going to ask you, right, is what are some of the warning signs? And it may not necessarily be a warning sign that you're seeing. It may just be so it's like you're saying, a new symptom that you're seeing, and that to be aware that it's not like what I take away from what you just said there is maybe if you have something else that pops up or something that's not resolved, is first maybe take a look at and understand what might be the side effects of the medications that you are taking.
Yes.
So is that
Yes, definitely. So I think, like you mentioned, if a new symptom does pop up and you are on medications, asking your pharmacist or your physician, could this be a possible side effect of these medications? And could I either change this medication to something that doesn't cause that side effect? Is there an alternative? Can I slowly taper it down to a dose that's lower but is still effective for me? We are trained, health professionals in that area where we have a lot of knowledge base to help patients to whether it's deprescribing or tapering down to the lowest effective dose, giving alternative recommendations and looking at the patient as a whole to make suggestions on what would work best for them, possibly prevent them from getting on more medications and thinking this is a new disease state or symptom that they're presenting with that they need a medication for.
Yeah. You just mentioned deprescribing. I don't know. What was that? There's this new thing now on Breck's World where it says, Breck lives out there on TikTok, with our TikTok viewers. And I think there's something out there that says, I was today years old now when I found this out. So I was recently today years old when I heard that term deprescribing. It never had been brought home to me that there was an opposite, that like once you had this medication, either it resolved the issue or you were always on it. So what is this whole deprescribing world you live in, Dr. Reshma?
Yes. So I am so glad you brought that up because that I feel like is a new word that people are not very familiar with. We always think about adding medications, but deprescribing doesn't only mean taking medications away. It's also looking and making sure that your medications are appropriate, they're necessary, they're needed. Like Dr. Levine mentioned, some meds don't need to be on forever. It may need it to be for a certain amount of time. There's no studies done on adding drug A and B and C, and then, now we're in side effects and now treating those side effects. So deprescribing is also looking at that. What side effects from your primary medications are now causing these secondary symptoms that you need prescriptions for, but can be eliminated with some alternative ways of lifestyle changes, diet changes, alternative modalities, maybe supplements. So deprescribing encompasses so many different meanings versus than just taking medications away, which I feel scare the consumers and patients because they do have a fear of, oh, I need this medication. Something will happen to me if I don't take it. And it's just educating patients to know and realize that some medications are not needed forever and they actually do more harm than good in the long term.
Yeah, I look at the background there that you have, Dr. Bob and Tim, that Brim Wellness, even though those clinical settings are right there in a community pharmacy where they dispense medication, the whole goal behind that is right medication for the right reason, and deprescribing is a big portion of that. Patients off of medications that are doing more harm than good.
I think deprescribing is one of the most challenging jobs that a pharmacist or a physician could have, because just like they don't test A, B, and C, and D, we don't know what it's going to be like when we start removing certain ones. So you really got to have the expertise. And so I admire you, Dr. Reshma, because it takes a lot to have that expertise and say, okay, which one are we going to pull out now or first and then second? And then we have to see how the patient feels, and then we go for something else. But somebody who's got a dozen or more of these meds on board, I'm wondering how you do it. It's really fantastic.
Yeah, and what just popped in my mind with with you two, with Dr. Bob and Dr. Reshma, what's that game, Jenga? Where you have to pull these things out little by little without falling apart.
Wow, that's a good one.
So
Yes, that is a good.
you're gonna have to
Yes.
come back, and so that people like me and all the other folks. I used to have a home care agency for the elderly, and I know a lot of them were at that time, right? We're really of the age where your doctor gives you this and you prescribe this is what you want to take. So there is that fear there. What's we're in our next segment we'll kind of get into what's the the cost of taking too many meds, but just to wrap this one up a little bit. So what is kind of the scientific approach to looking at how you deprescribe?
Yeah. So, mainly it's what is the patient's goals? And it is a journey. It's also an emotional journey. I look at it as kind of like being their coach
Mhm.
because you're managing their emotions, their fear, their overwhelm. Things have changed in their life, the way that they live their life has changed, and giving them the support and guidance to give them that trust factor as well. And then slowly looking at their medication list, seeing what are their goals. Of course, it's easy to eliminate duplicate therapies, unnecessary Was there a diagnosis for each medication? Is it still indicated? Are they on the right meds? Is there, working with their physician, getting meds taken off slowly, following through that journey? Because yeah, they could present in with another effect or rebound or, something else. And so then maybe going back up and saying this wasn't the right path, let's go down this road. So there's a lot of ebb and flow, and building that trust for them. But at the end of the day, they start realizing that they feel better. They start doing the activities they weren't able to do before. They feel more confident. They feel happier. And that's when they really value what we do as deprescribing
So
pharmacists.
great. So let's dive in that a little bit, right? Because we talked about, just as you said earlier, alluded to, when you start taking there's multiple medications, they may have fatigue or brain fog, and it's really or something else, a new pain, and it might just really be a side effect of that drug interaction. And then you work with them, and like you said, you gain that trust, and you're working with their physician and weaning them off. And you started to say in general how some people have responded or reacted, but can you give maybe a specific story or that says once you started working, somebody who had felt overwhelmed by and was
Mhm.
overwhelmed by their medication list, and what kind of changed for them as you helped them simplify it and wean them off some?
Yeah, for sure. So I had a patient, and she was in her 70s on 15 plus medications.
But wait,
She
you
came
said
to
50? Did you say 50?
15, 15, 1 5.
15. Oh,
Yeah,
I just said wow to 1.5.
Yeah. I'm sitting here going, that's a good dietary supplement, right? Because
exactly,
you're too
exactly.
filled up on taking pills to even eat food at that
Yeah.
point. Yeah.
And
Right.
that's one of the common effects as well, is they don't want to eat anymore because they're so full with taking their meds. But, she was just overwhelmed with the medications that she had to take. She wasn't sure what medication and why she was taking it. Also, organizing her day around the medications was also not easy. Some of them were 2 times a day, 3 times a day, at night, before food, with meals or without meal. It's just very confusing.
Yeah.
Putting all that together is quite a lot to add to a patient's plate when they're already, experiencing so many other things in life. So she started feeling confused. One of the things was she was not able to play with her grandkids like she used to. She noticed a change, felt some confusion, brain fog, just tired, not her normal self. And that's one of the big signs, is when you just don't feel like you're changed. You don't feel normal. You feel different. Something is off inside, but you can't name what it is. And so she was like, yeah, let me get a medication review done. And so she came to me and explained what she was going through and how she wanted to feel. And so we went through her medications. I got her down to about, I would say, 8 or 9 tablets. And she, some of the stuff that it was either duplicate therapy, some meds were, medications because she started getting anxious because of everything she's going through. And then sometimes, um, it can present as, "Oh, we're feeling anxiety now," which is a normal, reaction. But then prescribers could, or she may have presented that I need something for this as well. So she got added anxiety medications. So, and then we know anxiety affects our brain function, and medications affect our brain function and can make us feel really dizzy and confused and tired. So then we eliminated about half of the medications with her prescriber, and she actually got a lot more clarity. She felt better. She could go back to activities, participate in senior centers with her grandchildren, which was one of her goals, and just felt a lot better, and more empowered for, her medication. We made a chart of how to take her meds properly. She didn't feel, and now with dealing with 8 or 9 meds versus 15 was so much easier for her. She also had the energy to want to eat and, you know, do things that she hadn't been doing for a little while she was on so many. So it can really affect our life in so many ways that we don't realize.
Yeah, quite
Yeah.
a
Do
bit.
do they even make pill boxes that can mail out? I mean, you got to have a big, I don't know what,
Yeah.
Yeah,
to
that's
handle all
another
that.
issue is that, pill boxes are just very difficult to use. They don't have, it has maybe 2 times a day, but then they don't have something that's before a meal. And then they
Yeah.
might need
My
something
dad had
after a meal.
a tackle box, a fishing lure tackle box. I mean, that was how many meds that he was on at the
Wow, wow.
last. Yeah.
So how long did that process take with her?
It took about 6 months. So,
Oh.
yeah, from start to finish, we took about 6 months. We still follow up with her about every quarter and just make sure she's doing good. If she has more questions for us, she always calls us for anything. If she is feeling a symptom, just to clarify with us that yeah, it might be my medication or, life changes, our metabolism changes due to various different situations. So, medications and the way they're processed in our body is not always the same day to day. So, making sure that we don't add something just because we may not be at an optimal state at that moment, and to give our body time to adjust and recalibrate to its normal is also important. And just having a pharmacist oversight and following you through that process. So then you are maintaining your health, you're empowered, you have good quality health, and you're not going down the prescription cascade.
I'm wondering, do you have to work with their providers? If let's say they call you to ask you a question about, hey, I'm feeling this, I'm feeling that. Do you have to refer them back to their providers, or are you allowed to make adjustments to? It's kind of a silly question. I should know the answer, but I don't.
No, that is a great question because it just varies patient to patient. Some providers are open to working with me. Some providers, I send a letter with the patient and recommend medication adjustments. It just really depends on the provider themselves and how open they are to working with us.
Can they give
But
you
I have,
can they give you permission to make adjustments on your
yes.
own? Okay. So
So
that's what
there
you
is
mean.
collaborative practice agreements that we can make with physicians, but there's just a lot more entailed in that
Yeah.
process. So yeah, so usually just either working with them through a phone consult or with a letter is what we've noticed is the best. Um, and physicians have seen that our main goal is that the patient gets the best quality care. We prevent hospitalizations, we prevent med errors, and they have better quality of life. They're just happier. And so they've seen that in our patients when we work with them, and that's what's really built the trust and them wanting to work with us more.
We've covered all of the health benefits of having the proper dosing, the proper medication, deprescribing, but also there's a financial impact to the patient getting off of, that you got somebody from 15 medications down to 6 or 7, that probably cut their monthly cost in half too, right?
Exactly. Exactly. Yeah, there's a great financial benefit for decreasing the number of meds as well as future
Yeah,
consequences, which could be
exactly.
hospitalizations. Yeah.
Yeah.
I'm so glad that you covered the energy drain, because that was kind of a mind-blowing revelation to a lot of people, is that medications could actually be affecting their energy level. And you've got these combination of medications that are just quietly robbing your body of the nutrients that are needed just to even function. And so I'm glad that you covered that, because there is a lot of medications that do cause fatigue, and then
Yeah.
the combination of medications. Unpack that a little bit for us. Is it the actual nutrient depletion, or what is going on?
Yeah. So, like you mentioned, there is quite a bit of medications that do affect our cellular function through nutrients, through vitamins, minerals. And so, as we are on those medications, the combination of those medications slowly over time or within a few days or weeks, we start noticing fatigue or confusion or brain fog, muscle pain, nerve pain, so many different types of presentations, and now we think, okay, it's a new medication, but sorry, a new symptom or a new disease state, but it could just be the medication through over time depleting our nutrients and cellular function. And that's one important area I also like to reiterate with your audience as well, is that, people often think that side effects present right away, and they forget that side effects can present later on. And to remember that, okay, I am on meds, I'm starting to get muscle pain. I didn't get it right away when I started my statin, which we know, a lot of us know that statins cause muscle pain, mainly because of it affects the absorption of coenzyme Q10. And we end up getting muscle pain, and we think, okay, now we're presenting with something else. When in reality, we just were deficient in coenzyme Q10, which if we supplement them, not always, but a lot of times, we can help that muscle pain. So, it is very important to look at minerals, vitamins, nutrients when you're on medications, because that is a big factor of affecting our function, our cellular function, and, overall health. So, yeah.
Do you ever
So,
talk to, sorry, go ahead, Tim.
so I just need to be, yeah, because I beat you to that one, Bob, by a split
You
second.
got your
I,
jumped out of the
I hit
gate.
the buzzer just a split second before you, so I get
That's great.
So I'm trying to look at it here with all this going on. Is what's common? Are there some common things that says, boy, if this happens, could be indication of medication interaction? How do I know I might be developing a new disease and this is a new symptom of that? How do you kind of navigate that so that I'm not caught? When do I call somebody? When do I not call somebody? When do I feel like a hypochondriac and when do I not feel
Yeah.
like a hypochondriac? So how do you get through all this?
Yes. Well, definitely, if you are taking 5 or more medications, I would definitely see if the medications are contributing to that symptom. Also, if you have multiple providers, multiple pharmacies, if you are overwhelmed by your medications. Honestly, if it was my health or my parents, my family members, I personally, even if they were on 2 meds, I would just ask a pharmacist or your physician, can this be a side effect of the medication? And see, I feel that, we should always try to look at it through all avenues versus just making an assumption that it's a new disease state and that we can add a new med. I think we have that culture where right now we just add medications for a symptom versus thinking about maybe looking at what we are on and is that the cause and can we do something about it?
I have a comment that I think is really important for our listeners to know, and that is to take advantage of pharmacists, because pharmacists receive a lot more training in general about pharmaceuticals than the doctors do. And so pharmacists are a great resource. So that would be my first call. It would be to check with the pharmacist and say, what do you know about this? What do you think about that? Just to get their opinions, and then work with the physician. You can have that information and bring it with you when you see your physician. So I just wanted to say that.
Well, to add to that, Dr. Bob, go back to your original comment that you made about A plus B plus C, right? The patient also needs to tell the pharmacist the other medications that they're on, because
absolutely.
Yeah, because that one medication alone may not cause that side effect, but the combination of 2 or 3 meds could actually be causing something, right?
Absolutely.
Yes, definitely. That's a very important point, Breck. And I'm glad you brought that up because, sometimes we also just, we get an infection and take an antibiotic and we are on other meds at the same time. And now we're done with our antibiotic, but we start presenting with other symptoms. So also remembering to include meds that you were on maybe just even a month ago, because half-life of medications vary, and the half-life means how long the medication's in your body, and so it varies. So it's very important to have a whole picture of over-the-counter supplements, minerals, vitamins, nutrients, herbals, everything that the patient is taking.
So I'm glad you bested supplements. I was going to ask Dr. Bob how many supplements are, but I know he's on 20.
Well, hey, when Breck said that you have to include a supplement, it's like everybody's on 5 supplements, I think. Right. I don't know.
So how do supplements weave into this picture? We talked about, you said we want to watch how, you and Breck talked a little bit about how we want to watch how medication affects our vitamins and our minerals and other things. So that would say maybe you want to do some supplementation. But if I've got supplementation in the mix and like Dr. Bob, I'm taking boswellia and beetroot extract, celery root, and all this stuff. Does that polypharmacy in and of itself? I guess just how do you weave supplements into this whole story? What do you look for? What do you map it?
Yeah, so a lot of people assume that since supplements are natural products, not regulated, that they're safe. And that's not always true. Supplements, just like anything else, when used in excess, can be harmful. So it's very important. I consider it as well to be one of them. When I count the number of meds you're on, I include supplements, I include vitamins, I include over the counters, because all together they all interact with each other. Supplements are helpful and needed when necessary, but sometimes not needed. So those are some of the first things that we will take away as we do deprescribing or taking off medications off your profile, because sometimes it does more harm than it does good. So, making sure that you are on supplements that are regulated, meaning looked at by a physician or a pharmacist, like we talked about with the statin. You will need coenzyme Q10, but if you don't have a statin, do we need coenzyme Q10? Well, maybe. I don't know. I need to look at your whole disease state, your drug, your process. But, I really believe that, we need supplementation is also very, similar to prescription medications. It's definitely beneficial, but can be harmful as well.
Methylated versus raw ingredients. And that's something that I'll encourage all of our listeners to go back and listen to the episode that we did with Dr. Michael on that topic with supplementations. Dr. Patel, when you are working with patients that are on all these different medications, there's obviously emotional and mental toll too that they're going through with all these. What are most common things that you're seeing? Is it depression? Is it low energy? What are you seeing in patients?
Yeah, I see a lot of fatigue, exhaustion, confusion, which then leads to anxiety, depression. It affects their social life. So they just don't have that zest for life that they had before, which really affects everyone in various different ways emotionally. It's really sad how, some of the side effects of medications we don't think about really affect their quality of life with the way they live their life or the things that they thought they would be doing at that age, whether, grandkids, travel, um, enjoying holidays, meals, preparing meals, all these things that they thought they would be doing is now, difficult for them. And, it's really has affected their mental state. So bringing clarity, supporting them through that, I think is also very important as a deprescribing pharmacist, is understanding their journey emotionally, like I said, being their coach, and support system, their advocate for better quality health has really been a rewarding part of this journey.
Well, we've heard a lot of bad things that can happen with polypharmacy and being over medicated. But have no fear for our listeners. In our next segment, we're going to tell you how a consulting pharmacist like Dr. Patel can help fix it. Before we jump into the next segment, I want to take a break real quick to talk about our sponsor, which is BioLite. So recent surveys indicate that about 75% of Americans are chronically dehydrated. We always joke about here in the desert of Arizona, it's probably 90% are chronically hydrated. And BioLite is the only medical grade hydration drink out there. So it is everything that you would get in an intravenous IV, but in the convenience of a drink. So 650% more electrolytes than you'd get from leading sports drinks. BioLite is family owned and on a mission to help people feel better fast. BioLite It's an amazing product. I use it myself. I wish I would have had it back when I was running and training for marathons. I could have really used it then. We'll leave a link in the show notes so that you can get more information about this amazing product. So, Dr. Patel, there is good news, right? That these issues we've been talking about can be fixed, and polypharmacy is fixable with someone like yourself. So, how does someone get started in that? What does that review process look like?
Yeah, so mainly, reaching out, we do a comprehensive medication review, asking you what are your goals, what are some of the side effects you're feeling right now, getting an overall picture of what the patient wants and how they want to feel. Um, and what are their goals? What are they open to doing? There's so many different alternative modalities out there as well. And making those recommendations for them as well to supplement or assist them on their journey with
Give an
prescribing.
example of that a little bit, if you would. You alluded to other modalities. How do you work that? Where would you swap out a medication
Yeah,
and swap
so
in something else?
Yeah, so especially if they're on pain medications or having muscle pain or just pain in general, helping them with recommending a chiropractor, recommending acupuncture, the red light therapy, the PEMF mat, so many different ways that we could help them with that process. So I do make recommendations on alternative ways to help. Physical therapy, another one, which is huge. A lot of doctors do prescribe physical therapy, but supplementing with other ways that a lot of physicians don't think about has been shown to be very beneficial for patients, and slowly tapering them off pain medications.
Okay.
So
Good. Good.
that's some of the ways that we will recommend that. There's so many different other things
Yep.
we could talk maybe in the future.
Right. But
Um,
that's a beautiful example. I just wanted the audience to have an example to kind of
yes,
bring it home, an alternative part of it, the alternatives
yes,
or options aside from that, how you work it in there. So you've got this review. You start with their like a good consultant. That was career one for me. I was a consultant, but in technology. So you start with that, set the stage. What are your goals? What are you feeling? What are you experiencing? Have a little analysis there. Then what's the rest? Help the folks feel comfortable that how you get them to the end point and overcome that fear like we talked about earlier of them saying you're taking my meds away. Even if you want to take your meds away, you say, hey, my doctor prescribed this. So what's your process after that? How do you identify which ones to take off? How
yes.
much, when, all that type?
Right. So mainly, making sure every med is necessary. So that's a huge thing where people think they have to be on meds forever. And some medications you don't have to take forever. A common one people think they have to take forever is proton pump inhibitors, protonics, Prevacid, things like that, acid reflux medications. They've been studied for 3 to 6 months. And,
Breck's smiling over there because you're describing Breck. They did a whole episode on
Yeah,
his
I had a bad
thought about that one.
experience.
yeah. And, people, that's not something that needs to be on forever. And so making sure that it's appropriate and then working with their provider to say, hey, they've been on this medication this amount of time. Can we discontinue or taper? And especially with proton pump inhibitors, we want to taper first because we can get rebound. And then we think, oh, we need it,
Yeah,
forever. And
the
we don't.
rebound sucks, but it's not as bad as your bones breaking
Exactly.
because
Yes, for sure.
you're
When you
Yes.
robbing your body of the
when you all say rebound, I just want to clarify the rebound is a reappearance of the symptoms, and even more so than they were before. Is that what you would call rebound?
Yes, correct. Yeah. So presenting, with acid reflux again, which could be worse than what it was before or the same or, not as intense, but it still came back. So people think, oh, I do need that medication, when in reality, it's just our body adjusting
yeah.
to not having that medication in our system. So then it overcompensates and causes reflux. And so we can actually slowly taper the drug, which would then prevent that rebound. And then it's effective deprescribing. Walking them through that journey, being there with them, making sure we're doing it effectively so that they experience the least amount of side effects, have low fear, because, being the drug expert, we know how to decrease the medication effectively. Sometimes, patients will get medications taken off but either by themselves, or physicians are rushed or nurses are rushed, and then they forget that you need to taper something, and then all of a sudden they come back and they think, oh yeah, we need that med, and now they're on it forever, and then we get to brittle bones and all of that. So we do go through that process. So just calming them, like we talked about, with their fears, being there for them, answering any questions that they have, letting them know they may experience a little bit of withdrawal sometimes with pain medications, and what can we do to alleviate that withdrawal? Is there other things we can implement for them so that they can tolerate it better than just cold turkey? So really being there for them, holding their hand through this journey is really very important as well, because there is so many different factors, not only the fear but of it being gone, but will I have an adverse consequence to not taking this med too?
Yeah. I'm glad you covered the tapering, because I quit a PPI cold turkey, and yeah, the reflux came back with a vengeance, and could have been managed a lot better to just taper, right? Are
Yes.
there, I'm glad that you covered that working with the patient to kind of alleviate that stress that there may be, a little bit of a withdrawal, especially if somebody is pretty dependent upon a pain medication, and being able to coach them through that process of just tapering off slowly. So thanks for
Yes.
sharing that with us.
Yes. And that's also very common with anxiety and antidepressants. So making sure that those meds are tapered, because that's right now a big trend in our industry, is a lot of geriatric patients on anxiety and antidepressant medication.
Do you ever do anything with the nutrition? Do you want to find out about how somebody's eating habits, just to help you figure out if they're hurting themselves in that way as well? Or do you tend to
Well,
stay away?
yeah, I just believe in natural whole food eating, like food is medicine, trying to eliminate processed foods,
Yeah.
eating the foods that are on the perimeter of the grocery store and not the aisles,
Right.
is
Yeah. Good
how
point.
I guide my patients. I'm not nutrition certified. I do make recommendations to nutritionists if I feel like we need diet changes, but just guiding them towards, more healthy eating.
Yeah. And also, all the processed foods have so many chemicals in them. So then you got the processed food chemical potential interactions with the pharmaceutical drugs. So it's kind of a
Exactly.
wild, wild world out there in terms of nutrition and supplements and pharmaceuticals altogether.
Okay.
Yes, definitely.
And
I
so as
agree.
you work through all this in your process with people. Well, so how do people get a hold of you specifically before I ask?
So my company's WiseMed RX. Still in the process of branding the company. I, do private reviews, but email is the best way right now to get a hold of me, and I can, add that for you guys later. But it's Reshma at wisemedrx.com.
Okay, great. So with that, as you and Breck talked about the rebound, how quickly that can happen, and you talked about how to you know alleviate that a little bit. And then earlier on, you gave that great example of the person who took her 6 months, but she's back there running around, visiting Dr. Bob at the senior center.
Have clients at the senior center, I should say.
That's right. That's why Bob hangs out there. And now how she got back to play with her grandkids. Now, on the other side, we've talked about the mental, but also we're talking now. So the rebound can come quickly. You talk about the 6 month process when she got back to playing with her kids. But for those who kind of come in with mental fog, the fatigue, and the things of that nature, as you work with them and get them out of sort of the requirement stage into working with them. And I know, how soon can they have you seen improvements start in people?
So we've seen improvements within a few days or weeks, especially with patients who are on multiple CNS medications, which is central nervous system, meaning medications that affect our brain. We start seeing changes in them pretty rapidly, mainly because they're on so many medications that really depress their cognitive function, their brain function, and, just either are very sleepy, sedated, groggy, not eating, weight loss, and once we start changing that or eliminating a few big culprits, we start seeing changes pretty fast
Okay.
in those patients.
I think it's important to remind our audience, many of them experience it themselves, but this isn't just a discussion for seniors. Like you said, those seniors might be on 15 or 20s, but I think it's last thing I saw a while back was even at age 50, people are on 5 or more medications. But then you're saying you've seen people even younger than that that are now on that polypharmacy. So I think it's really important that we ought to keep that in mind as well as we look at things here.
I'm a believer that a lot of this is starting to happen with kids. A lot more kids are on medications. Do you get parents bringing their kids in or asking about the kids' medications? The medications that that the kids are taking, a lot of them are going to continue taking them throughout their lifespan. So that's a long-term buildup of, I'm going to say, toxicity from the various pharmaceuticals they're taking. But what about the kids?
We are seeing a rise in, medications used for different mental states. For kids right now, I'm seeing a lot of kids on antidepressants, anti-anxiety medications, which just affect them in various ways. I do believe there is a need for it in certain situations. But there is also a need to reevaluate if it is still needed because we all go through difficult times in life. And I don't want to downplay anyone's emotions or what they might be going through, but always remembering in the back of your mind that is there an opportunity to deprescribe? Are they on a dose that is effective for them? The lowest effective dose? Pharmacogenomics plays huge when it comes to medications such as antidepressant, anti-anxiety medications, because as we know, those medications are processed in our body in specific ways, and not all of us have the same way to process that medication as everyone else. So we've done, like we've talked about before, studies have been done on these medications, but again, we're all so different. And there is valid use to have monitoring and oversight with these meds. So, I don't have children right now, but, again, being a pharmacist, we can consult on that too, if that's something that people are interested in, is looking at that. But yeah.
Yeah, perfect.
And
Thank
then
you.
you brought up something else that drove some point home. Now people might be, and that's includes supplements in this as well. So there is the whole world out there. People taking creatine for muscle development and other nitric oxide even at young age to improve things. So I think key thing that came up to me, another key thing that came to me today was that point about don't just accept that all the supplements are great as well, even though they can be natural. And so when you take that into account, I think it's very key that people have that awareness. And to go back to what Breck started with, and just awareness now is look in that cabinet tonight or in that closet and say, how many medications do I have? How many supplements do I have? And then from that, say, really do begin to think, do I need all these things?
Yeah. And contrary to what the manufacturers would want you to believe that, medication is for life, right? Aren't most medications really intended for a short-term use?
Yes, they are actually. I mean, there is obviously like some blood pressure meds and things like that are indicated long term, but overall, most medications are not recommended to be taken lifetime, especially those to treat certain symptoms that we might be experiencing from medications. It's definitely very valid to look at, see if it's still needed. Is it still necessary? Can we use something else? Is that symptom still presenting? It may have just presented for a certain amount of time due to diet, lifestyle, all kinds of things. And just changes in the way we live can actually give us benefit and relief from that symptom than a medication.
Dr. Reshma, we always like actionable things here. And so, it may be common sense to all of us, but just to remind our listeners, if we go to the medicine cabinet, we find that we're on, 5 or more medications, what's a starting point for tomorrow morning? What should we do?
So I would recommend looking at all the medications you're taking, including OTCs, your supplements, any nutrients, multivitamins, anything that's in a bottle or liquid, even your topicals, and just making a list, writing it down, and showing it to your pharmacist or your provider and asking, are these all necessary? Are they still needed? Is there anything I can take away? Am I taking anything because of the primary medications that I'm on? And is there something else I can do versus take this medication? Like if you're on blood pressure meds, a very common side effect is dizziness. And you can then be on a medication for dizziness. So you may be able to eliminate that by being on a lower dose of your blood pressure med. So there's many different ways to look at it, but definitely getting into the cabinet, writing everything down, making sure it has a reason of why you're taking it, and then seeing if we can take away some.
Appreciate that, Dr. Reshma. And
I admire all of you pharmacists and you, Dr. Reshman, because it's such a challenging job. I know that because of my PhD's in pharmacology, and I spent a lot of years studying drugs and drug mechanisms of action. And it's pretty wild out there. So I just really acknowledge you for, all that you do and the way you and other pharmacists can help people. And I think you guys in some ways are really an untapped resource. So I encourage all of our listeners to you lean on your pharmacists. They're there, they're available, and they're happy to help. So, and I know that's the way you are too, Dr. Freshman. So thank you for all you do.
Yes, thank you so much. I appreciate that.
good deal. Well, thank you. Appreciate that, Dr. Reshma Patel, for being on with us today. And today we learned that taking more medications doesn't always mean feeling better, right? And sometimes you need to take a check and see where things are at. I learned it the hard way that a maintenance medication that I was on wasn't intended for long-term use, and found that out the hard way. So if you want to feel like you have, a clearer, stronger, more energy, feel like you're taking more control of your life, and, review the medications that you're on, and, make that list that Dr. Patel talked about, and see if they're still very much needed in your life. Also want to remind all of our listeners, please subscribe to the WellWave or the Wellness Wave Club YouTube channel, and we'll leave a link in the show notes for you. Also join the Facebook community, some great resources there, the Wellness Circle, and share this episode with somebody who may be on a lot of medications and needs to hear about this opportunity for them to do a review. And to all of our listeners, always remember, wellness, it's in you.